Now, taking a daily multivitamin could possibly be a health benefit, not just for your body, but for your brain. A new study from the Alzheimer's Association suggests that it may slow cognitive decline in older adults. To help us understand this encouraging news in regards to finding potential ways to combat Alzheimer's disease and dementia, let's bring in CNN's Dr. Tara Narula. Dr. Narula, tell us more about this new study.
Yes, so this was a study of 2,200 older Americans, so over 65, average age about 72, and researchers wanted to see if they gave them a supplement, either a cocoa extract supplement or a multivitamin, could they protect their cognitive function? So they gave them a cognitive test at baseline, and then after 3 years, they would test them year 1, 2, and 3. And essentially, they thought they might find a benefit with the cocoa extract group, but they did not. What they did find was a significant benefit in the multivitamin group. They found that it basically slowed the decline of cognitive aging by about 60%. In addition to that, in those patients or subjects that had underlying cardiovascular disease, they saw even more benefit.
So people seem really excited about this. Why, other than the obvious reasons, why do you think it's so interesting?
Well, prior reviews of nutritional supplements have really shown insufficient evidence to recommend that to protect cognitive function. So this is kind of the first large-scale, what we call randomized controlled trial, high-quality study to show a potential benefit. There's no FDA-approved interventions for older asymptomatic adults to protect cognitive function. So when you think of the potential public health impact of something as simple as a multivitamin that's safe, accessible, affordable, if it really is effective, you could have the potential to help millions of Americans. We know that 6.5 million of Americans have Alzheimer's disease. When you look worldwide, we're talking about 46 million adults who suffer from Alzheimer's dementia or some form of dementia. So real potential.
So what are the takeaways? Like, what should people at home be doing right now because they're watching us?
Well, it's important to emphasize this is not practice or guideline changing yet. This is definitely preliminary.
Just one study.
One study, important to replicate it in larger studies with a more diverse population. And what we really counsel people for in general is to eat a well-balanced diet, right? There's tons of bioactive nutrients in a good diet, and you can get them that way. There are certain populations that certainly need supplementation, and then there are other low-cost strategies that you can do to improve your cognitive function, things like exercise, things like managing your stress, sleep, avoiding too much alcohol or cigarettes, social stimulation, mental stimulation. So these are easy strategies to use.
And I have heard in the past people in the medical community express concern about supplements.
I'm so glad you asked this question because this comes up all the time, and many times patients don't actually tell you they're taking supplements. So it's really important for healthcare providers to ask that question, are you taking supplements, and to review with patients what they're taking. The supplement industry is not regulated by the FDA as drugs. They're regulated as foods. So essentially they get put out on the market without having to prove safety. The labels may not always be accurate, and so there have been many cases of supplements having contaminants in them, heavy metals, other chemicals, other types of drugs. Sometimes they can interact with prescription meds that you're taking, and people have ended up in the emergency room or hospitalized because of supplement use. Now, multivitamins in general are probably relatively safe, but even those, it's important to discuss with your primary care doctor or your doctor, this is what I'm taking, is it okay? Because in some patient populations who have underlying conditions or are taking other drugs, it may not be okay.
And if you're wondering why they're not regulated by the FDA, it's because the supplement industry is very wealthy, and they have powerful lobbyists that tell Congress they don't want to be regulated. Dr. Tara Narula, thank you so much. Lights out. What has sparked more than